Pay close attention. The news you're about to see is fulfilling Bible prophecy.
Welcome to another edition of YPN News, bringing you news as it relates to Bible prophecy and foretold by Yeshua Hawkins. We're going to talk a little bit about China relaxing its zero COVID policy, COVID vaccines effectiveness against what they're calling a mutated version of the Omicron variant, and a Christmas truce between Russia and Ukraine. But first, as China has eased restrictions on its COVID policy due to multiple protests across the country, the virus is now spreading rapidly across towns and cities, and hospitals are overstressed and morgues don't have enough room.
Well, in hospitals, patients are being treated in chairs and hallways because beds are full as medical staff, many of them who are sick themselves, are overwhelmed with critical care patients. Now, one nurse said that all the patients that come in have oxygen levels at only 50 to 70%. So there's a lot of pressure there with the severe cases.
She continued, medical staff fell ill one after another, and many of her colleagues are still working despite being sick. Well, the surge came after Beijing suddenly eased its zero COVID policy on December 7th, which was, of course, set in place since 2020.
Well, the surge in COVID cases has also trickled down to funeral homes as many queue in long lines just to get a space to bury their loved ones in dignity. Now, some cities in China are reporting some numbers on COVID data, but as of the weekend, Beijing is no longer reporting COVID data, making it impossible for the public to truly know the impact of COVID. So you can bet that if they're not reporting the numbers, they're probably pretty high and they don't want to scare anybody.
That's right. Well, the best the public can get at this time in regards to numbers and data is video posted on social media sites of body bags stacked on top of each other and, of course, uncounted deaths across China.
Well, a new COVID subvariant, the XBB.1.5, has the World Health Organization worried that it could be the most transmissible variant yet and is warning the public. Now, this new subvariant already makes up about 40% of new cases across the country and 75% of the new cases in the Northeast.
Wow. Early research is showing that this subvariant might be more contagious and more immune evasive than other Omicron variants. So far, there's no evidence that suggests it makes people sicker. Well, those with compromised immune systems and pre-existing conditions continue to be most at risk.
Well, doctors are analyzing the effectiveness of the existing vaccines against the new subvariant, but still recommend, of course, that people get the latest booster shot.
We'll take a look at this PBS NewsHour interview with epidemiologist Dr. Jay Varna for more information on this new XBB.1.5 Omicron subvariant and, of course, his point of view on the matter.
3 years into the pandemic, and yet another new subvariant of the coronavirus has emerged. As William Brangham explains, it's spreading rapidly and it's driving an uptick in new infections.
This new Omicron subvariant, known as XBB.1.5, now accounts for more than 40% of new COVID infections here in the U.S. and around 75% of cases in the Northeast. This new variant emerges while just over a third of Americans 65 and older, those at most risk for severe outcomes, have gotten the updated booster shot. As China deals with a massive surge in cases, this week the U.S. will require a negative COVID test from passengers flying from China to the United States. Dr. Jay Varma is a physician and epidemiologist. He's also a professor and director of the Cornell Center for Pandemic Prevention and Response. So there are these various COVID alarm bells that are ringing. Cases are rising. Some localities are asking for masks to be put back on with some mandates. And now this new variant has emerged, XBB. How worried should we be about this variant?
I think it's important for all Americans to understand that, this is a very precarious time for our healthcare system. So we're dealing with new COVID variants. We're dealing with, potential surge in infections that might arise from infections around the world. And we still have influenza and RSV to deal with. So I don't think Americans should be unduly alarmed. This variant is going to be causing some of the similar ups and downs as we saw earlier this year. But at the same time, it's just yet another reminder about the importance of vaccines and high quality masks.
So the initial reports that had come out that XBB.1.5 might be more able to evade our immunity, either from vaccines or prior infection, those aren't as alarming to you?
So what's concerning is that similar to these other Omicron variants, it's going to make people more likely to catch COVID. Similar to other variants, however, it doesn't appear that it's going to increase the risk of hospitalization and death beyond what has already happened in the past before. So again, more likely to get infected, but if you have vaccines and you have prior infections, you have similar level of protection. I think the other thing that is worrisome is, however, one part of our treatment arsenal, what was known as monoclonal antibodies, is no longer effective anymore. So it really leaves us only with Paxlovid, the one drug that's widely available, as our effective treatment option.
Well, they're saying this new XBB.1.5 is a subvariant of the Omicron. And if you remember when Omicron first came out, they said that was going to be, or at the time that they said it was much easily transmissible than any other form of COVID. Mm-hmm. And now they're saying that the subvariant that has basically sprung off from the Omicron is even more transmissible than that one.
Wow.
Well, Summit County Health Commissioner Donna Skoda said of the new Omicron subvariant, "We don't know if the vaccine remains effective against this variant. We believe it does." Now, she, along with other health officials, are uncertain of the vaccine's effectiveness against a continually mutating virus. And of course, that's what they've always been up against. The virus mutates. Are the vaccines going to work?
Right. And like we've mentioned in times past, as the mutations occur, it's like the virus is actually getting smarter at evading the immune system and the effects of the vaccines that are being put into patients.
Smarter and stronger.
That's right. Well, are COVID and the flu close enough in similarity that the healthcare system can use the same protocol for producing vaccines and routine vaccinations for COVID that are already used for the flu? Well, this next video sheds a lot of light on this subject. Please listen closely.
This is a COVID virus, and this is the flu. The two have some similarities. Both are respiratory diseases, both mutate regularly, and both have vaccines. And the framework for updating the COVID vaccine might look similar to the one used for the flu vaccine in the future.
We likely are moving towards a path with a vaccination cadence similar to that of the annual influenza vaccine.
But there are some key differences between the viruses and the vaccines that experts say makes applying the same framework challenging. And those challenges have created a debate on whether vaccinating COVID like we vaccinate the flu is actually the best way to tackle the virus. Here's how the update process for the flu vaccine works. The flu is the only vaccine that the CDC recommends be taken annually across the public.
Even if you've been naturally infected or vaccinated the year before, you may well not be protected against serious illness from the new strains that then come into the country. So that's why we need a yearly flu vaccine.
Annual flu vaccines are typically trivalent or quadrivalent, meaning they cover 3 or 4 different strains of the virus that can be circulating at one time. Global health organizations and researchers work together twice a year to decide which strain should be included in the vaccine. Since the northern and southern hemispheres have different flu seasons, they look at which strains are already circulating in other countries to predict which ones might make their way to the other side of the globe. Updated flu vaccines don't typically go through human trials for efficacy or safety before they are distributed to the public. Instead, they rely on tests on human samples like mucus and blood, animal testing, and extensive experience with the disease and vaccines. And there are similarities between that process and the process for the new bivalent COVID vaccines, which were authorized by the FDA in August.
These new vaccines were cleared for use without being tested in humans or having the results from the human testing. Also, they target more than one strain.
But there are also some differences, because COVID is less predictable than the flu. Flu season typically runs from October to March in the US. That's when activity peaks. But while COVID has had the strongest surges in winter, there isn't a predictable pattern yet for when the spikes will start or when a new variant might appear. Flu vaccines have also been produced for a long time and use a standardized process to target the same strains. COVID vaccines don't have the same coordination mapped out yet.
With COVID, we've got lots of companies working on different technologies of vaccines, and they are testing their vaccines with different strains. It's sort of just a little murky or a little messy there as to what the industry's doing.
Medical experts will be watching the rollout of the new bivalent vaccines closely to make decisions about the future vaccination process.
Researchers will test these new bivalent vaccines against these new variants, and they'll see how well they work, if they work, and that will sort of set the course for changing vaccines in the future.
Well, Katan, the medical industry is still just trying to find any help they can to fight against these new subvariants, whether they compare it to the flu or so forth, just to try to get a step ahead.
Yeah, which, like you said, try to get a step ahead, but really at this point, they're several steps behind the variants.
Well, the Kremlin announced a Christmas truce between Russian and the Ukrainian forces. Now, word of a break in the fighting first came from Patriarch Kirill of the Russian Orthodox Church. And it wasn't until President Vladimir Putin ordered his frontline officers to implement the 36-hour ceasefire that people realized it was for real.
Kyiv's reaction came from one of the President Zelensky's advisors, saying it was, quote, a cynical trap and an element of propaganda, end quote. So now Kyiv is in a tough position. The question is, should they abide by the truce, risking a surprise attack from Russia, or do they go ahead and keep firing on the Russians while they are following orders to silence their weapons?
Well, unlike what took place in World War I, where both opposing sides actually laid down their weapons and celebrated Christmas together, I doubt we're going to see that here between Russia and Ukraine. But everyone will be watching closely to see who observes the truce, and it could indicate the direction the war is headed here in the year 2023.
Well, a Chinese fighter jet came within 20 feet of a U.S. fighter jet in the South China Sea. The encounter caused the U.S. plane to swerve to avoid a collision, and the U.S. officials say the Chinese have been engaging in increasingly dangerous behavior in the air. The U.S. took their concerns directly to the Chinese government.
20 feet's pretty close for two jets there to be
moving several hundred miles per hour, too.
Well, Russia has banned countries that set price caps against its petroleum products. Energy analyst and lecturer at the Hertie School of Governance, Thomas O'Donnell, said, "This seems like a bit of bravado of Mr. Putin's part. Experts can argue about how effective the price cap will be, and we can discuss that. But the fact is, you have outstanding unity of the entire EU, G7, and so forth, very broadly on an agreement to very harshly sanction Russian oil."
Mr. O'Donnell went on to say, quote, the EU is taking no more oil by sea since the 5th of this month, and by the 5th of February, they won't take any more refined products by sea from Russia. That's a stunning hit to Russia, and now they will enforce this price cap worldwide. Anybody who wants to use any ships insured from the European Union will have to respect this.
Well, according to Bloomberg's latest data, shipments from Russia in the Baltic area had dropped by 50% in the early part of December when this cap was imposed. And interestingly, Katan, the price cap is just slightly higher than what a barrel of oil normally costs, which allows Russia to still have a little bit of profit. Right. So even though Russia's market is being greatly reduced, there are still some countries, such as India, that will import some because they have to get it from all different sources.
Right. Well, Thomas O'Donnell concluded by saying, quote, the EU made a big cut and the Biden administration got a little worried. This is so much of the world's oil that they thought, look, it's important that the oil keeps flowing to countries like India and China, and Turkey is another one that's being taken quite a lot. But let's try to keep the price limited, end quote.
So basically, Katan, instead of them putting some kind of additional sanctions on these countries that were buying the Russian oil, Europe and the United States just decided, they came up with this idea of go ahead and put a price cap on there, which is still a way for them to control or try to control who Russia sells and deals with oil with.
That's right.
And if you remember Janet Yellen, the U.S. Secretary Treasurer, when she was over there in India, she actually made a comment saying you can go ahead and buy all you want, but just do it at below that price cap. So again, as Mr. O'Donnell said, the EU had unity. They actually showed unity in this, that they all agreed to put this price cap on Russia for the oil.
Yeah, and I'm sure everybody except Russia is excited about these moves, because Russia, even though they're the ones suffering, they are still able to make a little bit of profit on the oil, but it's putting a lot more pressure on them economically in regards to this. But Russia also knows that this oil reduction is also affecting globally. It's affecting the United States and the European Union as a whole.
And if you remember, Yeshua Hawkins always mentioned the scripture there that said the prophecies that showed hurt not the oil, that you would see them fighting in these last days over the oil.
That's right.
Well, if you want to learn more about these stories, contact the House of Yahweh. When you do, don't forget to request your free copy of the Prophetic Word magazine and monthly newsletter. Here's how.
To contact the House of Yahweh, you can write them at P.O. Box 2498, Abilene, Texas 79604. You can call them at 1-800-613-9494. Visit them by going to any of their websites at Yahweh.com, YeshuaHawkins.com, and Yahweh'sBranch.com. You can visit our website by going to YPNnews.com. You can email the House of Yahweh at info@Yahweh.com. For all calls outside the United States, please dial the number on your screen. And don't forget the Yisrael Says and Ask Yisrael programs. You can find those by going to YisraelSays.com and AskYisrael.com.
Well, don't go anywhere. Up next is another classic message from Yeshua Hawkins. From all of us here at YPN News, I'm Jeffrey Heimerman.
And I'm Katan Alexander.
Thanks for watching.